Minister of Health Remwood Wells advising that the Bahamas government could end up investing more than $4 million to secure enough COVID-19 vaccines for 20% of the population and the necessary equipment to store and distribute it across the Bahamas. That will be the case if the government opts to go with the Pfizer vaccine, which has already been approved for distribution in at least one country.
And so there's a plan. And that plan right now equates to about a little over $4 million.
That $4 million figure includes the $1.6 million government plans on paying for the vaccine. $250,000 has already been invested. However, Wells told reporters on Tuesday that additional investments are necessary.
To be able to source the kind of equipment, because we're going to need to store it in country, so we need to be able to get the kind of freezer. So the engineers at the Ministry of Works is working on the HVAC, the heating, ventilation, air conditioning system that would be necessary to hold that kind of vaccine, but that's just the larger freezer. We're going to need the smaller ones to transport it to all the various islands. And we're intending, once we get the vaccine, to be able to deploy it to all islands at the same time quickly.
Then there's the rental of aircraft for family island distribution, as well as sending vehicles to make the overall process much smoother. The UK has already begun distributing the Pfizer vaccine to its citizens, while several other vaccines complete their trial periods. But as for when the vaccine will be available to Bahamians,
I want it like yesterday, honestly. As soon as we could get it, even if I have to fly a 747 in with it, we will do just that because it's important for the jumpstart and restarting of our economy.
Wells said the Bahamas government will invest in whichever vaccine the World Health Organization goes with. And while the government has said no one will be forced to take the vaccine, there remains concern. Wells said Bahamians will have one of two choices: take the vaccine or attain herd immunity.
And I want the Bahamian people to understand the only cure for COVID is herd immunity. That's it. It's the only cure. Herd immunity, where everybody stay in their houses for a month and the virus dissipates. Or we all take a vaccine to get to herd immunity. If persons in the Bahamas decide they don't want the vaccine, then we've decided we want to go the route of the hard way to get to herd immunity, which means the virus will spread to all of us eventually over 1 or 2 years. The ministry will have to deal with the repercussions of spikes in COVID in the country.
Wells says the vaccine will be free to those who want it, and that government will begin distributing it to frontline workers like healthcare professionals and then the elderly and those considered high risk. He said if Bahamians choose the route of herd immunity, then so be it, but that there will be at least 2 people in the country who will take the vaccine.
We're not going to be bringing anything in that's going to have a deleterious effect on our people. We are not going to do that. And also, we are not going to force a vaccine on anyone. If no Bahamian want to take it, no Bahamian other than the Prime Minister and myself, then we'll be the only 2 vaccinated.
For the Guardian News Network, I'm Kyle Joaquin.